So sometimes, even on the high flow nasal cannula, we're having to give a high concentration of oxygen, we're still having a lot of work of breathing, or the baby just doesn't seem well captured, they're still having distress and problems. Well, then we can bring in what we call CPAP or BiPAP. So this is a little bit different. So this actually makes a seal either over the nose or the nose and the mouth, and it looks a lot scarier, but it can be much more effective at improving the work of breathing. So how does it work? Well, basically, you can just imagine that when the lungs are sick, whether it's a virus or a pneumonia or there's fluid, you can just imagine there's a bunch of gunk in the lungs and they kind of get collapsed down. What we want to do is open those lungs up as much as possible because that lets more oxygen in and carbon dioxide out. So what the mask does is literally it makes a seal and then transmits that pressure to open the lungs up. So first it opens the lungs, and then second, you can imagine that the children are working to breathe. They're using a lot of pressure to pull air in and get it out. Well, similarly here, they don't have to work as hard if we're kind of giving them a little push by putting that pressure in through the CPAP or BiPAP mask.